numbers that I see on screen. I am shocked at the stats regarding any people of any color, but particularly the disproportionate amount of Black and brown people who are already underserved as it relates to mental health and emotional health. To take another blow and another setback seems devastating to me. What is the forecast of the mental health of our community post-COVID-19?
Well, we already had issues in all of our communities with mental health. We know that in America, 1 in 5 people suffer from some form of mental health illness or mental disorder. And if we account for African Americans, we are 20% more likely to suffer from a mental illness than the rest of the majority. So we already started with a bleak forecast, if you will, Bishop. And now you add into this the social distancing, and for some people, the social isolation. And for some folks, being home with abusers and child molesters and being in situations where really being outside the home was an escape. And now we compound that with all of the deaths that have occurred and the folks on the front line, the medical personnel, the mental health personnel who are treating these people who are young and perishing to this disease that we don't have any control over right now. So already mental health was an issue in our country because of the stigma. And again, the stigma is much higher in the African American community. But for all of us, we had the stigma. We had lack of access to care for some folks, which we saw more of a lack of access to care in the Black communities. And then we compound that by not being able to see one another, not be able to greet and hug and show love to one another. We are animals who love to connect. We love to socialize. That's what makes us different as mammals. We love to be around one another. So abruptly, we've been robbed of that opportunity. And then so now we're faced with all of the traumas from COVID-19, seeing people sick, seeing people who were, about to pass away or die, who became so ill that we thought we were losing them. And then the folks who did succumb to the illness. So now we have a whole nother set of traumas that we have to try to deal with. And then in the Black community, we see that the disparities have now reared their ugly heads again. We already knew that as a community that we suffer more from high blood pressure, from diabetes, from strokes, from heart disease. But now we see that from COVID-19, we're dying more because already we were placed on a platform where we were at a disadvantage. So we have a lot of work ahead of us, including the folks who typically we go to and turn to get better. And that's our medical personnel, including the mental health professionals who are trying to get us through this.
To the person out there who says, you have these health disparities, you brought them on yourselves, what do you say back to them?
I have plenty of data to say to that person. Okay. We did not bring this on ourselves. And it begins with the 450 years of slavery, of oppression. It has all of those insults from 450 years ago, and we've only had 50 years really to recover. We have never been on equal footing. We've never been on equal ground with the majority, never. And the times that we tried to catch up, because if we looked at this as if it was a race or a marathon, the majority started out 2 miles ahead of us or 5 miles ahead of us. And then they said to us, they didn't give us any running shoes, by the way. They said to us, okay, now you run the same race, but we're not giving you any shoes. We're not going to give you any preparation, no training, and you do the same thing and do it faster. So to the person who says that we brought that on ourselves, we were never on equal footing. We were never on equal footing. Slavery, then there was Jim Crow, and then we had the civil rights movement and all of the things that led to other disparities. And current day, when we look at the treatment of Black folks by the medical community, we know from good studies that Black people do not get the time that the majority receives when they're being seen by a white provider. White providers, we know this from studies, spend more time with the majority or white patients than they do with minorities. So we know that we have that in studies. So I say to people that we have plenty of data to show that racism, also minority traumas, are the reason that we suffer the most from a lot of these things. And Bishop, I didn't even mention that we're over 50% of high-risk populations, such as the homeless population, children in foster homes, the amount of people in jails and prisons. We're 50% or more, we represent those populations. We have more maternity deaths than the majority. So there's plenty of data to show that there is justification by the hands of other folks, not us, that have created these disparities.
You know, in addition to that, you have to consider the fact that we live in close proximity locations, often have more people in our housing domain per square foot than other people, living in complexes, using public systems of transportation. Frontline workers, we are the people who deliver to your house. We are the people who run the magnometers in the airport. We are the people who are frontline in the grocery stores, checkout counters, interacting with people on a daily basis. The percentage of employment amongst African Americans that puts us in close proximity to other people is much higher than our white counterparts. So we are on the front line. We are in the hospitals. We're nurses, we're doctors, we're attendants, we're cleaning the rooms, we're serving the food. High contact areas, disproportionately Black and brown people, and very vulnerable to a disease that is transmitted the way COVID-19 is.